Chapter 10 Diseases of the Respiratory System J00 J99 Pneumonia J12 J18. Pneumonia is a common infection that is coded several ways. 1. It is coded in combination with the responsible organism. 2. It is coded as a dual classification, combination codes that account for both pneumonia and the responsible examples. J15.0 Pneumonia due to Klebsiella J15.211 Pneumonia due to Staphylococcus aureus A02.22 Salmonella Pneumonia B05.2 Post-measles pneumonia. Examples of this dual classification coding include the following: I00 plus J17 pneumonia in rheumatic fever B65.9 plus J17 pneumonia due to schistosomiasis, pneumocystis pneumonia. It is a serious infection caused by the fungus Pneumocystis juravicii, which used to be called Pneumocystis carinii. The condition is coded as B59, pneumocystosis. It is frequently seen in patients with weakened immune systems, such as those with HIV disease or AIDS. Prior to the availability of antiretroviral therapy, this condition was a major cause of death among AIDS patients. When associated with AIDS, code B20 is sequenced first with an additional code of B59. Aspiration pneumonia. Aspiration pneumonia is a severe type of pneumonia resulting from the inhalation of foods, liquids, oils, vomitus, or microorganisms from the upper respiratory tract or the oropharyngeal area. Pneumonitis due to inhalation of foods or vomitus is coded to J69.0. Due to inhalation of oils and essences J69.1. Due to inhalation of other solids or liquids J69.8. Pneumonia due to aspiration of microorganisms is classified to bacterial or viral pneumonia in category J15 or J12. Ventilator-associated ventilator-associated pneumonia associated with the use of a ventilator is assigned to code J95.851, ventilator-associated pneumonia. If the organism is known, a code to identify it, B95, B96, B97, should also be assigned. Do not assign an additional code from categories J12 through J18 to identify the type of pneumonia. For example, ventilator-associated pneumonia, VAP, due to Staphylococcus aureus is coded to J95.851 and B95.61. Code J95.851 should not be assigned for cases where the patient has pneumonia and is on a mechanical ventilator and the provider has not specifically stated that the pneumonia is ventilator-associated pneumonia. Ventilator-associated pneumonia develops after admission. A patient may be admitted with one type of pneumonia and later develop VAP, PDX appropriate code from categories J12 J18, additional, J95.851. Ventilator-associated pneumonia COPD J44, category J44 is further subdivided to specify whether there is an acute lower respiratory infection, J44.0, and whether there is an exacerbation of the condition, J44.1. Unspecified, J44.9, X. Patient has COPD with acute bronchitis, J44.0, J20.9 COPD. An acute exacerbation is a worsening or a decompensation of a chronic condition. Chronic obstructive pulmonary disease with acute exacerbation, or exacerbation, in exacerbation, decompensated, acute exacerbation, exacerbated, or uncompensated. Asthma J45, categorize mild intermittent, mild persistent, moderate persistent, severe persistent. Under that categories each has subclassification right pointing arrow NOS, with acute exacerbation. With status asthmaticus, other and unspecified asthma, J45.9. A diagnosis of asthmatic bronchitis without further specification is coded as J45.9. If the diagnosis is stated as exacerbated or acute, chronic asthmatic bronchitis, code J44.1 is assigned along with asthma code J45.9. Examples: J45.902 asthmatic bronchitis with status asthmaticus, J44.9 plus J45.40 moderate persistent asthma with COPD, J44.1 plus J45.901 chronic asthmatic bronchitis with acute exacerbation. Respiratory failure J96. Respiratory failure is a life-threatening condition that is always due to an underlying condition. Respiratory failure can result from either acute or chronic diseases that cause airway obstruction, parenchymal infiltration, or pulmonary edema. Respiratory failure is classified as 1. Acute J96.0, 2. Chronic J96.1, 3. Acute and chronic combined J96.2, 4. Unspecified J96.9, 5. The fifth character is used to specify with or without hypoxia or hypercapnia. Sequencing of acute respiratory failure could be PDX or additional respiratory failure may be listed as a secondary diagnosis if it occurs after admission, or if it is present on admission, but does not meet the definition of principal diagnosis. It could be PDX when encounter reason supports by medical documents and no other chapter-specific guidelines comes in between. Examples: 1. A patient with chronic myasthenia gravis goes into acute exacerbation and develops acute respiratory failure. The patient is admitted due to the respiratory failure. Principal diagnosis J96.00 acute respiratory failure, unspecified whether with hypoxia or hypercapnia. Secondary diagnosis G70.01 myasthenia gravis with acute exacerbation. 2. A patient with emphysema develops acute respiratory failure. The patient is admitted through the emergency department for treatment of the respiratory failure. Principal diagnosis J96.00 acute respiratory failure, unspecified whether with hypoxia or hypercapnia. Secondary diagnosis J43.9 emphysema, unspecified. Example 3. A patient arrived in the hospital in acute respiratory failure and hypoxia. The patient was intubated, and the physician documents that the patient is being admitted to the hospital for treatment of the acute respiratory failure with hypoxia. The patient also has congestive heart failure. Principal diagnosis: J96.01 acute respiratory failure with hypoxia. Secondary diagnosis: I50.9 heart failure. Unspecified. Some ICD-10 chapter-specific coding guidelines, e.g., obstetrics, poisoning, HIV, newborn, provide sequencing directions. If a patient has respiratory failure associated with a condition from one of these chapters, follow the chapter-specific guidelines when assigning code J96.0 or J96.2. Examples are the following. X-4 A patient is admitted to the hospital with severe Staphylococcus aureus sepsis and acute respiratory failure. Principal diagnosis: a 41.01 sepsis due to methicillin-susceptible Staphylococcus aureus, R65.20 severe sepsis without septic shock, J96.00 acute respiratory failure. Unspecified whether with hypoxia or hypercapnia. X5 A patient who is diagnosed as accidentally overdosing on crack cocaine is admitted to the hospital with acute respiratory failure. Principal diagnosis: T40.5X1A poisoning by cocaine, accidental, initial encounter. Secondary diagnoses: J96.00 acute respiratory failure. Unspecified whether with hypoxia or hypercapnia. F14.10 cocaine abuse. Uncomplicated influenza J09J11, J09 influenza due to certain identified influenza viruses. Novel influenza, avian influenza, bird influenza, influenza A, H5N1, influenza other animal origin. Not bird or swine, swine influenza, J10 influenza due to other identified influenza virus, J11 influenza due to unidentified influenza virus. Coding should be based on the provider's diagnostic statement that the patient has avian influenza or other novel influenza. If the provider records suspected, or possible, or probable, avian influenza, or novel influenza, or other identified influenza, then the appropriate influenza code from category J11, influenza due to unidentified influenza virus, should be assigned. Vaping-related disorders U07.0, U07.0. Vaping-related disorder, for lung injury due to vaping, assign code U07.0 as PDX and whatever manifestation as additional DX. Associated respiratory signs and symptoms due to vaping, such as cough, shortness of breath, etc., are not coded separately when a definitive diagnosis has been established. However, it would be appropriate to code separately any gastrointestinal symptoms, such as diarrhea and abdominal pain.